we are never sure of our patients' outcomes until they happen. We weren't sure how this would happen, how this would work out until we tried it, and it's worked out pretty well. We're very pleased that everything is working and that our careful planning has resulted in such a dynamic and interactive event. And I really want to thank again, Brittany and the TA cabinet, who've done an excellent job of planning things together for today. And the KNA office staff, who are working very diligently behind the scenes to make sure this all happens correctly. So now I'm going to hand it back over to Dr. Schuster, our KNA lobbyist, who's going to introduce our invited legislators and provide some information about their nursing and healthcare legislation backgrounds. So I'll turn it over to you, Sheila. Thank you.
Thank you very much, Donna, and hello again, everyone. I'm so glad that you were with us this morning and that you had some productive meetings with legislators after our initial sessions. I'm very pleased to have some of our champions, some of our heroes and heroines in the legislature with us. Let me start with Senator Reggie Thomas, because he's got a little bit tighter time frame. Senator Thomas represents Senate District 13, part of Fayette County, and he has been a long, long time and very vocal supporter of school nurses. So Senator Thomas, tell us a little bit about your work around putting a nurse in every Kentucky school every day, all day, please.
Well, here's where we are presently. The governor's put out his budget. It's now being discussed in the Senate. At some point, the Senate will finish their work. It has to go back to the House because my guess is that there'll be some difference between the Senate version and the House version. Right. The bill right now does not provide for a nurse in every school. That has not been something that I've achieved my full objective on. I will say that the Lieutenant Governor, Jacqueline Coleman, is very much supportive of that idea. And my understanding is that she's going to come talk with Nursing Association sometime this year to get a better handle on how we can begin to achieve that in the 2022-24 budget. I think we'll see something done in that direction in the 22-24 budget. But right now, the emphasis was given to other areas in the budget, such as broadband. So I think that's where we are. We're still in a holding pattern, but I know the Lieutenant Governor is very interested in moving this forward, and we'll have further conversation with your office this year about doing something in the fiscal year 22 through 24 budget.
Yeah, I'm wondering, Senator Thomas, what you hear from your colleagues over on the Senate side in terms of support for this issue. When we did our nursing remote town hall meetings, we had 5 of them all over the state back in August and September. We heard nothing but support. Obviously, the funding is always the drawback, but I'm just curious about whether you're hearing that from your colleagues.
Well, Dr. Schuster, I will tell you right now, I haven't heard much on this issue. Senator Hornbach can probably speak more to that in terms of what he's hearing from his colleagues. I do know that, in terms of the Senate Education Committee, there's probably more of an approach, and Lisa will love this, to get more psychologists involved in the schools. I think that's psychologists and counselors in schools as opposed to nurses. And so I think that's where the discussion that's where discussion is right now. Yeah. More leaning toward psychologists and counselors as opposed to school nurses.
Yeah, and I think we need to get the message out there that nurses are particularly educated and trained and experienced in pulling together resources and being the kind of care coordinator, which is really what our students need. So making that link between the community providers and the student that needs help, communicating with the counselors and the mental health professionals, and doing some screening, obviously, of students around some of those issues. So we appreciate your support. You've been very outspoken and been a real cheerleader for us, and we appreciate that. Let me turn to your colleague, Senator Paul Hornbach, to talk to us a little bit about the Kappa CS bill. Senator Hornbach represents Senate District 20, which is Carroll, Henry, Jefferson, part of Jefferson, Shelby, and Trimble. So he does a lot of traveling around, and he has been a longtime supporter of APRNs in this issue. So Senator Hornbach, tell us where we are with Senate Bill 78, please.
Okay, thank you, Sheila. Thank you for having me today. Going back just a second to Senator Thomas and the question you had for him on getting nurses in the schools. I was at Shelby County Schools last night with a lot of administrative officers that were there, and they said that they hoped by the end of this year that they would have a nurse in every school in Shelby County. So they are working towards that. So they're doing a good job.
Great.
Still a lot of focus on counselors and mental health professionals. But they thought, in Shelby County at least, they thought that having the nurses there was that well-rounded person that could draw in others, like you said. So anyway, just wanted to comment on that.
Yeah, that's great feedback. We're
on Senate Bill 78. Talked to Julie again today. Of course, she's the sponsor of it. I think it's going great. I think we've got a lot of support. We still got the normal ones that we're getting some pushback from. But I think everybody realizes, the members, even some that last year were not very supportive, they realize that because of the pandemic, the situation we're in now, the need is greater than ever to have access to care. And that's going to come through nurse practitioners. There's a shortage of docs. There's a shortage of nurses. And the only opportunity we have to make sure that everyone has equal access to care, I think, is through the nurse practitioners, and my colleagues feel that now. I mean, a lot of them have come around from where they had been, being bigger supporters of this, because we all know that if people don't have their health and society doesn't have its health, then we don't have anything. And we have found out in this past year with the pandemic that if you have somebody in your local area that you can go to as a general practitioner, somebody like a nurse practitioner to go in and help you when you first get sick, rather than waiting too long. Right. And that's why we need to have more healthcare professionals. And that's what I've told everybody. You know, I think this has shown that, you know, getting there early and getting treatment early, I don't care if it's COVID or if it's cancer, it makes no difference. Getting it diagnosed early and starting those treatments is the most important thing you can do. So I'm excited about it, Sheila. I know we've been working on it a while, but I think this is going to be a very good year.
I sure hope so. Our motto is get it done in 21. So that's this year, right?
That's right.
And we do have, as Senator Hornbach mentioned, Senator Julie Rocky Adams has moved into the primary sponsor role with that bill and could not be with us today because she has another committee meeting. But she actually is carrying this bill and also carrying the evacuation of OR smoke bill for us, which is Senate Bill 38. So I do think, and we have bipartisan co-sponsors, I think, Senator Hornbach, which I think is very important.
Yes.
A newly elected position in the Senate, Senator Karen Berg from Eastern Jefferson County and Oldham County has signed on as a co-sponsor. We're hoping that will help because it ends up being a turf battle between the nurse practitioners and the docs, and it really should not be. It should be focused on access to care. Excuse me. So we're hoping with that bipartisan support that Senate Bill 78 will move, but we certainly thank you for your support of that. Let me turn now to our House colleagues, and I'll turn to fellow psychologist, Representative Lisa Wilner, who is the primary sponsor of the banned conversion therapy bill, which is a bill that KNA is supporting. She represents House District 35 in Jefferson County. Representative Dr. Wilner.
Well, thank you, Dr. Schuster, and thank you, nurses. So good to be with you guys. The most trusted profession in the country. So I wonder if you guys have any questions about the conversion therapy bill. You know, we have a broad range of sponsors on this bill, and we have a huge coalition of support for it. And I was very, very happy last year when the Kentucky Nursing Association, nursing or nurses, I may have said it wrong.
Nurses.
Kentucky Nurses Association,
Right.
thank you, signed on to that coalition in support of this bill. I continue to have conversations with folks from across the state and from across professions, and people continue to be surprised that this is something that actually happens, that kids are actually being subjected to. And so I think having coalition partners, that it's not just, a few out there legislators, that this is, that this is across the state, across the Commonwealth, across professions, across party lines, that this is something that is so critical to address in the state. And as you guys know, other states that have passed it, it's not all, quote, blue states that have done it, because this is really a mental health issue. It's a suicide prevention issue. It's a health and well-being issue. And it should not be attached to any party. And we have this year and last year bipartisan support, bipartisan co-sponsorship in both the House and in the Senate on this issue. So that's very encouraging.
Yeah. Do you want to define very briefly, Lisa, what conversion therapy or conversion torture is for those
Absolutely.
who might not know it?
Yep, and absolutely. And conversion, therapy is really a misnomer. You guys certainly know as nurses, therapy means any kind of treatment that helps, right? Whether it's, massage therapy or speech therapy or physical therapy, therapy is to help. And conversion therapy is not a therapy at all, but it is an effort to change a person's sexual orientation or gender identity. And there are two problems with trying to change a person's sexual orientation or gender identity. The first is that it doesn't work. So even if we decided that that was a good idea, we have 3 decades of peer-reviewed studies that show us that doesn't work. Sadly, this is so terrible, but so many of and I don't have the numbers off the top of my head, but so many of folks who advocated adamantly for conversion therapy and were conversion therapists themselves have come out as people who themselves were failed conversion therapy patients. And because they want it to work, they believe it works, but it doesn't work. So that's the first problem, is that it's ineffective. And the second problem is the incredible harm that it does to folks. 42% in one large scale study of young people who were exposed to these practices had a suicide attempt. It doesn't account for the numbers with a completed suicide. And that does not address the folks who maybe did not have an attempt, but have suicidal ideation, who are suffering from depression, from anxiety, from substance use, from loss of faith, from alienation from their communities. The list goes on and on and on. And the harm doesn't end when the practice ends. So if somebody is subjected to these practices for a year or 2 years or 4 years, and then they stop having these, treatments, this therapy, the harm lasts and lasts and lasts. It inflicts severe trauma that can take years and years and years of intensive therapy to try and recover from. So, this is inflicting harm. Conversion torture is a better term for it, as Sheila used that term. And very grateful to the nurses for signing on. And I know that nurses are not by definition liberal or conservative or Democrat or Republican. You're folks who care about helping people and who care about health and who care about mental health and who care about well-being.
Yeah, thank you very much. Appreciate that. And to your fellow House colleague, we'll turn to Representative Sherilyn Stevenson, who represents House District 88 in Fayette County and has been our go-to person on the SANE nurse situation. Representative Stevenson, welcome.
Thank you so much, Sheila. Thanks to everybody for being here, and thanks for giving me a few minutes to talk about this issue. You know, last year we started having talks about just, you know, a bill saying every hospital has to have SANE access 24/7. And of course, that sent some panic out among some folks. So we thought, you know what, let's actually look at this a different way. And Sheila was heavily involved in this, and I thank her so much for her input and guidance always. But we thought, let's get a look at what's going on. Let's really look at the statistics about sexual assault across the Commonwealth, and then maybe we can you know, press the issue a little bit harder when my colleagues here get a look at those numbers. As we all know, almost half of all women and 1 in 5 men will be sexually assaulted during their lifetime. And a sexual assault nurse examiner is absolutely the gold standard for care. They, you know, they're trained in that trauma informed approach, and they're going to treat possible injuries at the same time collecting forensic evidence. And that not only is the best treatment option for those victims, but it's also their best chance at justice should they try to seek it. So that's really what we're after here. So we want a report from KNA, from the Hospital Association, from KSP, from various sources to compile information about what sexual assault looks like across the Commonwealth, where we have SANEs, where that access is available, where it's not. And then hopefully we can, you know, try to push some legislation forward from there. You know, none of us come here to set out to put mandates on every organization from Paducah to Pikeville, but sometimes, you know, we have to push the envelope for folks in order to do what is best for our people. And I stand prepared to do that. And I appreciate your all support of us getting this information into our hands. So hopefully we can start to make it better. I will say there is some federal legislation moving forward right now that I'm really hopeful about that would actually create grant money for hospitals and nurses who wanted to get those certifications. But I think all of you know that what we're seeing currently is a lot of nurses that want to do this have to do it on their own time, and they're often doing it out of their own pocket. That is something that we've got to change so that we can better accommodate those people that show up and need a treatment and need a right kit.
Well, I appreciate that. And I think we had some SANE nurses on earlier today who identified themselves. So we're grateful that they've taken that training. One of the things we want to look at is what would make it easier for nurses to get that training, because so many of them are interested. You can get it both for adults and for children. And it's hard to imagine that we have to get it for children, but we do.
Yes.
And I think the other story, Representative Stevenson, is that you came to this because a victim came to you as a legislator, right?
Yes, one of my constituents came to me, and she actually came to me about CEUs being required for emergency personnel, and it just kind of like ballooned from there. So it was something that Senator Harper Angel had filed previously, and she was like, "Hey, would you think about filing this?" And so then as we really started having conversations, it grew into, well, this is really what would fix the problem. This is really what is at the heart of the problem. So that is how that changed. Yes.
Yeah, thank you. And that would lead me to a question that I'll put out there for all 4 legislators who are on. We have lots of nurses and nursing students on. They've had a little taste of talking with the legislator maybe, but what's one tip that each of you would give to maybe a brand new advocate, somebody who hasn't talked with a legislator yet, but what's something that would be top of mind? And I'll start with you, Representative Stevenson, since you're on camera right now.
Well, we are regular people. We get up and put our
That's
pants
right.
on one leg at a time, just like you do. So, never be afraid to come, have conversations with us. Don't be afraid to hold us accountable and ask us really hard questions. You guys have that privilege and you should absolutely exercise it.
Yeah, that's great. Senator Thomas, what advice would you give to people that maybe are just starting out as advocates?
Well, I would fully agree with Sherilyn on part A. I think her statement, don't be afraid, come in and sit down and talk to us and express your opinions. I think she's absolutely right about that. That's part A. I would say though, part B would be very organized and clear in terms of what you want, because, and I don't mean this, from a condescending standpoint, but we're all very busy, and we can recognize right away when people are just there to waste our time or don't really have anything to say, and you're going to lose respect from us if that's all you're there for, is just to be present. So have something in mind you want to discuss about a particular field, particular policy. I think that will go a long way in terms of, one, gaining our respect, and two, encouraging us to want to work with you to get your objective complete.
Yeah, great. Senator Hornbach, what would you suggest? Is he still with us? Oh, he may have stepped away. Representative Wilner, what suggestion would you have?
I think, remembering that we need you as much as you need us. And I'd say that, about votes maybe, but I think even more important is my best legislation, my best bills, the bills that I am most passionate about, came to me from constituents. They had a concern, they had an issue, they had a problem. They're able to share that story with me, and we work together and develop a bill. So, we need to hear from you. You're our eyes and ears and hearts and souls of what we need to be working on up here.
I will say yes, yes, yes to that.
And how about a little patience too? I find that brand new advocates are very impatient sometimes. They want to get it done that session. And as we know, and on some of these bills, we have worked for literally years to get them passed. So I think maybe sprinkled with the passion is maybe a little patience. I wonder if you all are finding it more difficult with COVID because people can't be in the annex to come and meet with you. Is that what are you seeing, Representative Stevenson? In terms of the COVID, is that interfered?
So it's really odd to be here. It's very empty. We're used to having people all over. And so it's a little bit eerie to be here and it be, kind of quiet. But I think everybody has pivoted to just like this. We're all taking Zooms left and right. So my office door used to be revolving about every 15 minutes, and now it's just Zoom is happening about every 15 minutes. So, I think everybody has adjusted well. We at least, we were 10 months into this when we started this session. So everybody was well, it's a well-oiled machine at this point.
Yeah. Senator Hornbach, let me get back to you. The question is, what advice would you give to new wannabe advocates or newly minted advocates in terms of talking with legislators?
Well, and I apologize for having to step away a minute.
Sure.
But, the most important thing right now is probably the emails. I think that most of my counterparts up here, that's the way they're getting most of their information is through the emails right now. If you have a personal relationship, or if you know somebody that's got a personal relationship and you can get them to advocate for you, please do that too. It's more difficult than it's been in the past because Sheila, you're not here in the hallway reminding us. We don't see the mass of white coats that we've seen before. So, it is a little bit different, but I would say that emails and still that personal touch if they're in your district to try to do that and develop those relationships over the interim when we're not in here. And I know that you've encouraged your advocates to do this, but I hope they took that step and built those relationships while they were at home during the interim.
Yes, I always remind them. In fact, when you all were home the latter part of January, we recommended that people reach out to you. So much easier for you all when you're not caught up in the bustle and hustle of being in session, I think. So let me, I know you
Sheila,
all,
I'm going to have to get off.
Yeah, I know all of you have caucus meetings.
Sheila, I've got a caucus meeting I've got to run at 1.
Well, thank you all so much. And let's all give a big wave to our legislators, our friends. We appreciate you all so very much. Thank you so much for joining us. We really appreciate it. Let me just say for a moment, since Senator Julie Rocky Adams wasn't able to join us, that she represents Senate District 36 in Jefferson County and is the lead sponsor now of the APRN bill, which is Senate Bill 78, and also is the lead sponsor of Senate Bill 38, which is the evacuation of operating room smoke. And this is her second session. And she did that because a constituent who is on is going to speak here in a few minutes is an OR nurse and went to her as her senator. And Senator Adams picked up this issue. She had no idea. And we found this with legislators. They have no idea what OR smoke is. So I guess imagining that all of the surgeons and the operating room nurses and so forth are in there smoking. I see we have one of our CRNAs on, and they know that people are not in there smoking, but this is the smoke generated with the lasers and so forth. So she has been dogged with this, and also with the APRN bill. She's been a co-sponsor of that for the past 4 years that we've had that bill. So just want to give her a shout out. If any of you are in her district, you might shoot her an email. Thank you for her sponsorship. And I know we're expecting the Lieutenant Governor, but Donna, I'll turn it over to you if you want to get started with some of the other speakers until they get on. Because she was going to be available at 1. So I'm expecting her just any moment now.
Any minute?
Yeah.
Okay. Well, Delano, would you like for me to get started with the affiliates, or do you want to take some questions or something for a few minutes and hope that the Lieutenant Governor can join us?
Well, I know that many of our affiliates, especially one, is in Florida in her car. So we might want to let her speak first so that she doesn't have an accident on our watch.
Okay. So start with Audrey.
Yes, if we could start with Dr. Dinker, that would be excellent.
All right.
Thank you so much. Oh, go ahead. I'm sorry.
Well, I just wanted to introduce the affiliate organizations. We have several affiliate organizations who are able to join us today. We really appreciate you guys being with us. So I'll just we'll start with Dr. Audrey Dinker then with Galen. Thank you.
Thank you. I appreciate you all asking me to speak today. And yes, I'm the Executive Vice President of Nursing at Galen College of Nursing. And one thing I wanted to mention today about nursing is that nurses are needed more now than ever. And I know one of the representatives mentioned the fact that nursing is the most trusted profession in the country, and we need them everywhere. And so one of our vision statement at Galen is we change the life of one to care for the lives of many. And that's exactly what nurses do. Not just our school, but every nurse, we change the life of one to care for the lives of many. And so what I would want our constituents to hear, what I would want our legislators to hear is to help nurses across Kentucky expand access to others getting into nursing school and being able to finish. And I myself was a high school dropout in Eastern Kentucky. And I had one person that changed my life, that drugged me along and made sure that I made it through nursing school. And nursing changed my life. And so now it's my privilege to be able to give back to the nursing students and help them reach their dreams and their goals, and who otherwise may not be able to graduate from nursing school. So I do appreciate the fact that we have these wonderful representatives and senators in Frankfurt representing us and supporting the bills that support nurses. Again, now more than ever, we need nurses. We need them to care for the lives of all Kentuckians, and I appreciate the opportunity to be here.
Donna, I think our Lieutenant Governor has joined us.
Yes.
So if I might introduce, I have the pleasure of introducing the Lieutenant Governor of Kentucky, the Honorable Jacqueline Coleman. Lieutenant Governor Coleman is an educator and a coach and a mom and a stepmom. She is a fervent advocate, a fiery advocate for education and for health for Kentucky's children and their families. So we welcome you on behalf of Kentucky Nurses Association, Lieutenant Governor Coleman. Welcome.
Well, thank you so much, Sheila. And Audrey, I've heard your story before, and I love hearing it because to me, that's what education is all about. It's breaking cycles and creating transformational change and giving people real opportunities. And the fact that you took that and turned it around and are giving back is I just love hearing that story. So thank you for sharing it again. So good afternoon, everybody. I wish we were in person. I wish we were all at the Capitol together. But obviously we're gonna be moving through this pandemic, and we are on our way out of it. But one of the very first thing I want to say to you all today is thank you. Thank you for what you do every day in a normal year, but certainly thank you for what you do every single day during a worldwide health pandemic. We couldn't have gotten through this without you. All of the work that you do every day, it has saved lives. It has helped to move us forward during times of anxiety and isolation, and the vaccinations that we're able to get now is what's going to move us out of this. And so I just want to start by saying thank you. And I know, as we have moved through this pandemic, a lot of us have experienced quite a bit of pain. And I think none more than the people who have lost a loved one or the people who lose patients because of this. The trauma and the emotional weight that you carry through this is something that I can't fathom. And so I'm grateful that we have people like you doing this work every day. I say we're emerging from this pandemic, and I think we've learned a few things. First of all of us know how to spell unprecedented now. I've decided I want to retire that word at the end of this. We can all measure, we can all pretty much like eyeball about a 6 foot increment now and know how to keep that distance from people. But I think more than anything, and I'm so grateful for this, we have learned how much we took for granted the service professions. Our first responders, our public school system, our healthcare workers. Those are the people that they make up a huge part of our community. They're our friends, our neighbors, our relatives. We see them at ball games. We go to church with them. And the work that you do every day and that they do every day has I think just, it was something that we took for granted prior to 2020. So if we've learned anything coming out of this, I certainly hope that it is a renewed appreciation and gratitude towards our healthcare heroes. It was a year ago yesterday that a room full of nurses helped me bring Evelyn into the world. So I'm officially the mother of a 1 year old, 1 year and 1 day year old. And I'm way too old to have a 1 year old, but we'll talk about that later. But but it's just a reminder that, you know, even in our happiest times, our nurses are there to celebrate with us. And so, you know, all year, every day, in any circumstance, you're on the front lines and you're bearing witness to what this virus has done to our families and to our communities. And so even in the darkest times, you're also there to grieve with us and to be there for our families. And so the roller coaster that you ride every day is one that, again, I hope that we remember to show more thanks for moving forward. So I just think that that's a testament to your unimaginable strength and your commitment to the families and communities across Kentucky. And that should implore us and require us and commit us to supporting you as you continue to do this life-saving work. My oldest daughter, Emma, the one that I adopted, she actually graduated college last spring and was really happy to hear that she has decided to go into nursing. And so she actually started nursing school this fall. And I'm so excited for her because I know her ability to care and to give back. But I also am excited to know that she's going to be in a profession where she is needed. And so I'm just thrilled that this is the career path that she has chosen, because I know that she is going to have a full and exciting and happy career in front of her. And we want to continue to build that pipeline. Obviously, we have a nurse shortage in Kentucky. I don't have to tell you that. We also have a teaching shortage in Kentucky. And it's because these two professions have historically been taken for granted. But I'm committed to building a really strong pipeline in Kentucky of nurses to enter this profession prepared and ready to walk into a hospital, get to work, and to help to relieve all of those of you who have been on the front lines for the last year. So from a workforce development standpoint, I obviously welcome your ideas and your suggestions for how we might be able to do that, because that is really something that's on my radar that we're working on in our cabinet right now. And so I'll just close with this. You all of you are inspirational. You're selfless. You're compassionate. And there are days when I myself feel worn out and at my wit's end. But I think of what you do, and I realize that I have to push on too, because we all have to work together to do what's best for Kentuckians. So I'm thankful that you are our healers. I am thankful that you are our friends. I am thankful that you are our heroes in Kentucky. I hope you feel loved. I hope you feel appreciated. I hope you feel that from me right now, because I don't even necessarily know that I can find the words to do it adequately. But I just want to, again, say thank you, not just as Lieutenant Governor, talking to you today, but as a mom, as a wife, as a Kentuckian. I just want to say thank you.
Do you have a proclamation for us?
I'm sorry, Sheila, you cut out.
I said we have a gubernatorial proclamation.
Oh, I don't know about that. Let's get through the pandemic. How about that?
All right. And I failed to introduce you to Donna Metter, who is the KNA president.
Hey, Donna.
And to Delano Manson, who is the CEO of the
Hey.
Kentucky Nurses Association.
Great.
So
Thank you for being here
we
with
thank
us.
you. We thank
Yes,
you
thank
for being with us, Lieutenant Governor.
Absolutely. Thank you
Yeah,
all.
thank you so much for your time today. That's wonderful.
Absolutely. Yeah.
Great
And
hearing.
feel free to stay on if you like. And Donna is going to move us through our program.
All right. Well, thank you again very much, Lieutenant Governor. That was excellent. It's good to hear that support and that recognition. So we're going to get back to hearing from our affiliated organizations. We thank Dr. Dinker for getting us started with that. And we have Dr. Jessica Estes with us, who is from the Kentucky Board of Nursing. So next I'm going to call on Dr. Estes to talk to us about what's going on in your organization. That's very important for us to all hear from you for sure.
Good afternoon. As always, I appreciate the opportunity to speak to you all. So pandemic is no different for the regulatory boards than it is for anyone else. The last year has been a tremendous amount of growth for how we govern nurses, how we look at administrative regulations, and then really how we evaluate the decisions that we've made from a regulatory standpoint. You know, when you look at things like, why did we put an administrative regulation in place? We have to adapt those in a situation like this. And I'm going to use a simple example. So up until the last 6 months, the Board of Nursing did not collect email addresses for our licensees. It was not a regulatory requirement. Well, guess what you learn in a pandemic when you don't have an email address? You learn very quickly that you cannot communicate widespread with your 90,000 licensees if you don't have email addresses, because getting paper mail out is almost impossible. So those are the kinds of things that we've learned in this pandemic experience, that we need to be forward thinking to be able to manage all of the things that come to us. So the other things that have happened, and you all have seen them develop, is we've become more paperless in our processes. We've moved document uploads into an online format. They're going into a portal so that you can always see the documents that you submitted, which gives you the opportunity to really control the information that you're submitting. You can see what's there. We have moved from a paper mail circumstance for payments to an online format. So we have the ability to send those requests out outside of licensure. So that gives you a more secure method to be able to pay your bills or your civil penalties or apply for CEs or those kinds of options. We've gone live with CE Broker, which is our monitoring tool for continuing education for nurses. We actually are doing the first CE audit via CE Broker this year, which will allow nurses to upload those documents. And again, we can see them and they can see those documents that are in the portal. So going from a philosophy of we're touching a significant amount of paper to everything is housed in a digital format was a tremendous amount of growth. And we've done that in a roughly 12-month period. So just to give you all an idea of what our licensure statistics look like, just so you can have that information, we have about 72,000 active RN licenses, 13,000 active LPN license. That number is still holding steady. It had been declining for about the last 5 years, but it seems to have leveled out. We have about 4,800 licensees that still hold that retired license. Advanced practice registered nurses are at a little over 10,000, which is kind of a milestone for them. We have 312 sexual assault nurse examiners. And if you were paying attention to Representative Stevenson's conversation earlier, that's far below where we should be in the state in terms of getting access. We also happen to license dialysis technicians. There are 698 of those. And then the new licensee group for 2020 was the licensed certified professional midwives, and we have 20 of those. So one of our goals has been transparency. So make sure that you check our website. We're going through a big upgrade and we'll modify that in July to make things easier and accessible. And then you'll also have the opportunity going forward to see us on social media. So we will put our social media policy forth to the board for final review next week. And then you will be able to follow us on Twitter and Facebook. So as always, I appreciate the opportunity to be here. 2020 and 2021 have been a challenging year. It's required a lot of patience for us. We've all operated in what we call the crisis standard of care, and that goes across the board. And pat yourselves on the back, because it's been a tremendous effort that we were all swimming in the same direction on.
Thank you very much. We very, very much appreciate your time today and sharing that information with us. Next, I'd like to call on Dr. Sonia Harden with U of L School of Nursing, Dean of the School of Nursing.
Hello, I'm Dean of the U of L School of Nursing. And since 2020, with the COVID-19 pandemic, it's resulted in so many people being hospitalized and nurses doing their best to provide care during a severe shortage. I think all nurses understood that it was inevitable that they would need to care for COVID-19 patients at some point during the pandemic, as well as care for each other. And today it's been touched on about many nurses suffering from the psychological trauma due to so many deaths. I want to take a second and share with you that my daughter is also an ICU nurse, and she's taking care of COVID-19 patients. And she describes a scene where every day 4 or 5 patients are coding, arresting. They stop breathing. And it's inevitable that at least one dies. She's told me she has seen more deaths since she ever came into nursing. And compassion fatigue is a huge issue with our nurses. And our nurses have really, in this state, stepped up beyond anything we can imagine. You know, Nightingale said, very little can be done under the spirit of fear. And with that being said, our cardinal nurses here at the University of Louisville have certainly stepped up and shown no fear. They continue to lead and care for others. My daughter was off on a Sunday and got a call on Monday and was told that a patient on her unit, somehow accidentally, no nurse had gone into his room for 8 hours. And, you know, she cried. And she said, if I'd just known, I would have gone in and pulled an extra shift. Can you imagine, Mom, somebody laying in a hospital bed and no one going into his room for 8 hours? Now, how could something like that happen in the United States? I will tell you how it happens. It happens because there is such a shortage and such a need for nurses. My commitment to the Commonwealth, and it's my passion, is to prepare individual nurses to meet the workforce needs of the Commonwealth. Every nurse should be able to provide the care that they know our patients deserve. And everyone deserves a nurse. And I need our government to advocate for nurses, because when you advocate for a nurse, you're advocating for your constituents and you're advocating for your own future needs, because everyone will need a nurse. I will share with you that hearing the stories up front of what is going on in healthcare, sometimes it's chilling for me to hear what our nurses are experiencing. We are working very hard here to set up an environment where we can increase our enrollment by allowing more simulation to occur with our students. The Kentucky Board of Nursing has been very supportive in allowing more simulation in lieu of clinical hours. And my goal is to try to get us to where 50% of our clinical hours are simulation, so that we won't overly tax our hospital systems, but we could increase our enrollment in the future. So I just need our government to help us every way they can. And if there's an opportunity to provide resources to increase the enrollment for nurses, please do so. Thank you.
Thank you so much, Dr. Harden, for sharing that information with us and your daughter's story particularly. Next, I would like to call on Darlene Herska. Hey, Darlene, I see you there. Would you please tell us a little bit about the Kentucky Association of Peri-Op Registered Nurses?
I sure would. Good afternoon, everyone. I am Darlene Ruska. I've been a registered nurse, well, for a lot longer than the 32 years that I did work in the operating room. And I am chair of the Kentucky State Council of the Association of Perioperative Nurses. And it's made up of more than 500 nurses, OR nurses in Kentucky. Nationwide, AORN has made up of over 160,000 operating room nurses. And the mission of AORN is to advocate and support for patient and staff safety. And my focus for the Kentucky State Council of AORN has been to promote smoke-free operating rooms in Kentucky. Did you know that inhaling surgical smoke is equivalent to inhaling the smoke of 27 to 30 unfiltered cigarettes every day? Surgical smoke is generated by the smoke producing equipment such as electric cautery and lasers, and has been found to contain over 150 toxic chemicals such as benzene, formaldehyde, and methane. And it includes blood and tissue fragments, bacteria, viruses, and now the COVID-19 virus is also included in the smoke. There's documented cases of surgeons and nurses who have developed cancers and lung diseases directly related to cases they worked on. And with over 40 years of research on the dangers of surgical smoke, it is really time to protect our surgical workers and patients, including the newborns of C-sections, because it's proven that there's no safe amount of surgical smoke. Knowing the dangers of surgical smoke and experiencing it firsthand, I approached my Senator, Julie Rocky Adams, about this issue, and she agreed to sponsor legislation and has been a very strong advocate for it. In 2020, the bill made it through the Senate unanimously before COVID cut the session short. Senator Rocky Adams reintroduced the bill in 2021, and once again, it has passed the Senate Health and Welfare Committee and the Senate unanimously, and now it's on to the House. Many organizations, along with AORN and the Kentucky State Council of the Association of Operating Room Nurses and the Kentucky State Nurses Association, the American College of Surgeons, the Society of American Gastrointestinal and Endoscopic Surgeons, and the Association of Surgical Technologists and the Anesthesiologists, and the Council on Surgical and Perioperative Safety and NIOSH with CDC all support and recommend the use of surgical evacuation equipment for every smoke-producing surgical procedure. In fact, last year, just as we were introducing this bill, Dr. Ning Liu, from a medical researcher physician out of Stanford University, reached out to provide us with a recent study showing the effectiveness of using surgical smoke evacuators. So it really is important all across the country and the world. Colorado and Rhode Island have passed smoke evacuation bills, and several other states like Kentucky are working on it. Senate Bill 38 is important as it will provide an extra layer of protection for surgical staff and their patients. Kentucky needs smoke-free operating rooms, and so I would please ask you to call your senators and, well, the senators to thank them for passing Senate Bill 38, and call your representatives to ask them to support surgical smoke evacuation and to vote yes when Senate Bill 38 comes to them. And I really wanted to thank Senator Julie Rocky Adams and AORN and KNA and all of you who support smoke-free operating rooms to keep our state Kentuckians safe. Thank you.
Thank you very much. That's a great overview and a great background on your organization. Thank you, Darlene. All right, next, I would like to call on Dr. Sheila Valander from the University of Kentucky College of Nursing.
Hi, thank you, Donna. Yes, I'm Sheila Valander from the University of Kentucky. I am the Associate Dean of the MSN and the DNP program, and I'm also over faculty practice. I also am an acute care nurse practitioner, and it's my honor to represent Dean Janie Heath, who's unable to be with us today. I'm from Western Kentucky, Owensboro. I live in Louisville and I teach in Lexington. So I have a little bit of a breadth of Kentucky, but I'll tell you, I was elected to serve on the KNA Governance Council for the past couple of years, and that has really helped me have a little better, broader understanding of our needs across the state. So I'll be speaking to you today from a little bit from that perspective, as well as from what we're doing at the University of Kentucky. And as we've heard all day today, never has there been a time that any of us can remember where the call for service has been this great for our nursing community at large. And I want to state from the University of Kentucky how grateful we are to all of those that have not only answered the call, but whose tireless efforts have dramatically impacted patient and family members' lives who they've touched across the state during this past year. And for many of those families, that nurse, as we heard from Dr. Hardin's experience just previously, that may be the only touch point that that family has for weeks or even months, as we have members that have been in these units by themselves. And we just couldn't be more proud to be members of the same profession and practicing alongside you. But as we heard by the Lieutenant Governor and also by many others today, these sacrifices have not come without a heavy toll for many of our nurses. So a question needs to be asked: who is shepherding the mental health and wellness for our nurses? So we would like to support the call for action with the mission for mental health and wellness for Kentucky nurses, and share in that the leaders of the Kentucky Nurses Coalition or Action Coalition, they've been actively engaged to address the silence of nurse suicide too. So I want to bring that to the forefront. And I know most of you are aware, but I want you to hear that nurses are at a much higher risk of suicide than the general public, and that our nurses are struggling with issues like fear, anxiety, depression, and post-traumatic stress as they respond to COVID-19 and continue to care for all patients. So in collaboration with KNA, Kentucky Nurses Action Coalition leaders are advocating that Friday, May 7th be declared Kentucky Nurse Suicide Prevention Day. Kentucky nurse leaders are grateful for the relentless efforts of so many who continue to build a culture of health. And now we invite you to help us strengthen the mental health and wellness of our nursing workforce. It's our hope that by legislators and nurses working together, committing time and resources to implement these intentional strategies, that we can emerge a stronger, healthier Kentucky. So I want to thank KNA for such a wonderful day we've had today, bringing our nurses and our legislators together. And I want to encourage any of you to reach out to us if there's any efforts that we at the University of Kentucky can assist you with. So thank you for this wonderful opportunity today to be here.
Thank you very much for that presentation. We very much appreciate your time today. Next, I will call on my colleague, Dr. Michelle Pendleton from the Kentucky Organization of Nurse Leaders. And I'll ask Michelle to tell us what's going on with KONL these days and any priorities and focus that you guys have.
Thank you, Donna. As Donna said, my name is Michelle Pendleton, and I am representing KONL, which is the Kentucky Organization of Nurse Leaders. The KONL is an affiliate of AONL, which is the American Organization for Nursing Leadership. So in 2020, we really shifted our focus, as many folks did. You know, just hearing the conversations and being active today really makes me proud to be a member not only of KNA, but to support the nurse leaders within Kentucky as well through KONL. I'm proud to be a nurse. I'm humbled by the activities of the year. And I'm especially proud of our fellow nurses. You know, through the pandemic and through the issues that we all had in 2020, it really led to disruption. So if you think about how everything was so status quo, and then we have this disruption, and through that disruption came innovation. So as many of you talked about, through this, we were able to put changes in place. We were able to come together in different ways that we haven't done before. One of the things that KONL did is they held best practice discussions with the nurse leaders across the state and the nurse leaders involved with KONL. And this happened very early on. So we started to do this actually in mid-March, and we did it through really the height of the pandemic, and then we still continue to do it through the year. We had discussions with things like, how are you handling staffing? We have stopped our inpatients, we've stopped our surgical cases, we have the staff. How are you handling that? What are you doing with those people? How are they being cross-trained? We had great discussions on utilizing nurses still within the scope of their practice, but just in a different way and a different means. We looked at unit level care. We looked at establishment of COVID units, non-COVID units, using red tape. We looked at education. How do you do a just-in-time education as you're shifting those nurses into other roles and other positions? And so it really brought to light that leadership group within the state and how they could come together and how they could focus on, how are we going to get through this together? So it was really, in that sense, it was a great year for KONL, and it was a great sense for nurses as they demonstrated their ability to be innovative. There's other great things that we did. In KONL, we held our first virtual conference in the fall. Like many first virtual conferences, there are some little bit of technology bumps along the road. We laughed, we had fun, we kept going, and we moved on. We changed our format to have a couple of hours on 2 days so that people could really join within their workday. And we had great response and great attendance to that. We did offer that conference free of charge to KONL members as a thank you for the work that they've done for that year, and that went over very well. We focused on the AONL nurse competencies. We had Eric Martin speak, who is the AONL president. We had Gwen Moreland from UK Healthcare, and she focused a lot on professionalism and business skills and how to continue to do that. And then we had Ruth Carrico from U of L, who talked about COVID and leadership and communication. How do you pull that all in together? And with something happening like COVID, how do we focus on leadership and communication? We were still able, even though we offered that conference for free, we were still able to provide our scholarships that we do every year. And there were 2 folks that were chosen for those. We were still able to provide our Lifetime Achievement Award, and that went to Ina Glass. If you know her, she's the Administrator and Chief Nursing Office at Ephraim McDowell at the Fort Logan. Very well deserved, amazing lady. And then we're able to provide our Emerging Nurse Awards through each of our districts. Lisa Thornsberry, the Academic Service Line Director at UK Healthcare, Marcy Back is the Director of Quality and Infection Control Patient Experience at Baptist Health Richmond. Kristen Weeder, who is a Director at Norton Audubon Hospital, and Blakely McDaniel, who is with in the Twin Lakes District. So just closing and to wrap that up, it was a great year for KONL. It was a great year in the sense that we were really able to step up and provide those services for supporting our fellow nurses. And I appreciate the opportunity to talk for just a few minutes about KONL's impact last year.
Thanks, Michelle. Thank you very much for sharing all that you guys have done and continue to do. And our last speaker from our affiliate organizations is Jennifer Wiseman. And Jennifer is the president-elect of the Kentucky Association of Nurse Anesthetists. So thank you, Jennifer, for being with us, and tell us what's going on with your all's organization.
Sure. So like you've mentioned, my name's Jennifer Wiseman. I am president-elect of the Kentucky Association of Nurse Anesthetists, or KYANA. We are an affiliate member of the KNA, and professionally, we represent over 1,000 CRNAs here in the Commonwealth. As you all may or may not already know, we provide anesthesia services in every county in Kentucky that has hospitals or surgery centers that offer surgical services. So that's like 75 counties in our state that have anesthesia services that are provided by CRNAs. And we are also proud to be sole anesthesia providers in nearly half of those counties, including 17 critical access hospitals located in those counties. And while we do belong to our respective, professional organizations, CRNAs know the importance of maintaining our KNA membership and being involved in the organization that represents all nurses. That is, key and extremely important. We're all very proud to be nurses. All of us have, worked in a variety of settings prior to going back to school. We all have RN, experience, and we've all been there. So we're constantly just trying to promote nursing and public health initiatives across our state. Sometimes they're more directly involved with us and sometimes they're not, but anything kind of public health related is always important for all of our patients. this legislative session, we've been strong supporters of several nursing bills that have come through, particularly the removal of the Kappa CS, as well as the smoke evacuation bill. And as you can see today, all of us coming together as one voice and advocating not only for our professions, but for our patients is wonderful, and great things can happen with collaborations like that. Just to speak on COVID, since everyone else has kind of done that, all of our meetings went virtual this year too. So that's been something fairly new to us as well. And then, like many nurses in the surgery centers and ORs, when the elective cases stopped, CRNAs were kind of forced to look at different roles that we could be of assistance and provide help and participate in, because our case numbers went way down when we weren't doing elective procedures anymore. So some of the roles that we've taken on, some CRNAs have gone to be strictly on airway COVID teams, and have been the sole provider, intubator of those patients. The standards kind of came out that, the most experienced provider should be intubating these COVID positive patients, because you want to spend as little amount of time in the airway as possible to reduce as much spread as possible to everyone in that unit or in the area. So a lot of us have joined teams and gone in and did that. We've also done a lot of education, because what's not typical to, I feel like a lot of people, which is really typical with COVID, is laying these patients on their bellies, putting them prone. And we do that all the time. So I feel like that's one area where we were of great assistance. We were super comfortable doing that and love to share, our tips and tricks, and just kind of teach people how to do that, because that's not something we deal with. Our patients are not used to being on their stomachs, and we're not used to putting them on our stomachs or on their stomachs. So, just trying to think outside of the box, everyone kind of working together as a team just to get done what needs to be done, and take care of these people the best that we can, is kind of what we've all been doing this past year, and rolling with the changes and the limitations on supplies, and we're right there with everybody. So, like others have mentioned, if the KNA can ever be of assistance with anyone or with anything, never hesitate to reach out to us. We enjoy being a part of the KNA and just promoting nurses. So thanks for having us.
Thank you very much, Jennifer. I think Michelle brought up the disruption and innovation, and I think that proning and teaching people how to take care of patients who've been proned is a great example of this difficult situation of this disruption producing some wonderful innovation, and I'm sure some teaching and education that people had not planned on, people who don't normally educate their coworkers, doing a lot of that. Thank you for serving on those front lines and being on the airway team.
Yeah.
Very important. All right, we are going to move along and go back to Brittany Welch, our Government Affairs Cabinet Chair. And Brittany's going to give us just a recap of, again, our KNA legislative priorities, and then we're going to wrap things up. So thank you, and I'll turn it back over to Brittany.
Thank you so much, Donna. So you've heard a lot of excellent speakers, a lot of our champions. Senator Thomas, who's a real strong supporter of our school nurse initiative. And that focus of the initiative is really just to put a school nurse in every school all day, every day, because the data supports it, because our outcomes and our children really need it. Senator Hornbach presented on Senate Bill 78. He, along with Senator Julie Rocky Adams, are real champions for removal of the Kappa CS. And that's really an access issue, and ensuring that the outcomes of our more underserved populations, and to allow nurse practitioners to practice to the full extent of their education and training. Representative Wilner presented on her bill to ban conversion therapy, and for lack of a better term, is essentially abuse. on those individuals who are struggling with identity crisis, or whose parents feel as though they're struggling. Representative Stevenson presented on the Sane Nurse Initiative. And then we had, again, Senate Bill 38, which is our surgical smoke initiative, who is championed by Julie Rocky Adams. So although these are our priorities, we support KNA. Your Nurses Association supports several bills. We also oppose those bills who directly work against access to care and the overall health outcomes or nursing practice throughout Kentucky. So you can absolutely navigate to Kentucky Nurses Association website. I also want to thank the Governmental Affairs Cabinet for today and making today possible. And that includes Eva Stone, Sheila Melander, Beth McCraw, Teresa Bell, Cindy Pearson, and Linda Robinson. So without all of those cabinet members, today would not be possible. And of course, Kentucky Nurses Association administrative staff, and as well as Delano. So again, thank you everyone for joining. Without participation in events like these, our voices would not be heard throughout Kentucky.
Thank you. Thank you very much, Dr. Welch. I'm assuming that we've got a lot of people on this call still. So I'm assuming that the topics that we've covered today are important to folks, and that whole government affairs concept is important to folks. That cabinet for KNA members, you're welcome to join those meetings. You wouldn't be a voting member, but if you just want to listen, if your passion is in this area and you want to listen in on those meetings, feel free to contact the KNA offices, and they can let you know how to do that, because I think we have a large group of people here who were very interested in hearing what all this was about today. I am going to turn it back. I want to thank the GA cabinet again for all the work on this, and the KNA staff. I'm going to turn it back to Delano, who is going to share a proclamation with us and going to wrap us up. So back to you.
Lieutenant Governor was so excited about talking to nurses that she didn't leave any time in her talk to read the proclamation. So I'm going to do that for her and the governor. This is the proclamation by Andy Beshear, Governor of the Commonwealth of Kentucky, and it reads, "To all to whom these presents shall come, whereas nurses positively impact the health of Kentuckians across the Commonwealth, and whereas the nursing profession is recognized as one of the nation's most trusted professions, and whereas nurses have been licensed in Kentucky since 1914, and more than 90,000 nurses are currently licensed in the Commonwealth. And whereas the Kentucky Nurses Association, established in 1906, is the only full-service professional organization for the state's entire nursing population. And whereas thousands of Kentucky's nurses have provided care for COVID-19 patients, have worked to prevent the spread of the virus, and prepared students to join in the fight in fighting the pandemic, and have contributed to our scientific understanding of healthcare crises. Now, therefore, I, Andy Beshear, Governor of the Commonwealth of Kentucky, do hereby proclaim February 9th, 2021 as Nurses Day in Kentucky to recognize the invaluable contributions of all Kentucky's nurses. Done at the Capitol in the city of Frankfort, the 8th day of February in the year of our Lord, 2021, in the 229th year of the Commonwealth. Signed, Andy Beshear, Governor, Michael G. Adams, Secretary of State. I don't think we can do better than that, people. So, to close us out, I want to say thank you to all of you who joined us today, particularly Donna. I know that it is a challenge with your full-time job to be with us all day, but you did it. And to Sheila, incredible job in getting legislators to want to be with us and getting them here. To the legislators who came, talked, and answered questions. And I would like to remind all of you to participate in our social justice night on February the 25th. It's from 7 to 9 p.m. The film is Incarcerating Us. and we will have the movie and then a panel discussion. We have a judge, and Senator Neal will be joining us at that time, and a nurse from the prison system. Also on March the 11th, we have COVID-19 in the school system, which will be presented by our own Dr. Eva Stone at 6:30, and all of these things are on our website. We also have an incredible list of on-demand education, which you can get to from our website as well. And I just want to mention that the Kentucky Nurses Association at the beginning of this pandemic started presenting classes so that nurses, who are the most trusted profession, that they had the information about COVID. We did our last class on January the 20th. It's not our last class, but the last class we presented was on the COVID vaccines, and you can get to that through the website as well. Want to mention that KNA members and volunteers are continuing to participate in the vaccine clinics around the state, as well as testing around the state. So if you all, we're going to be sending out a evaluation. If you would give us some feedback about this event, let us know how we can do it differently, how we can do it better. We would really appreciate it. Again, I would like to say thank you all for being with us, and have a great afternoon.
Quick question, quick comment.
Yes, ma'am.
You've been asked in the chat box if you could share the proclamation. So
absolutely.
You'll have a way to do that. And Jennifer acknowledged that we also gave out a lot of face shields, distributed them across the state. So we appreciate that. Thank you. And you're very welcome.
Absolutely.
Thank you to the School of Engineering for creating them.
And I did not mention how much I appreciate that the affiliates for KNA have come together to support all of the Nurses Day activities. We could not do what we do without the nurses in the state of Kentucky and without our affiliates. And so we appreciate you all taking time out of your day to be here with us as well.
Thanks, everybody.
Thanks, everybody.